So good afternoon, good evening, wherever you are in the world. It is a fantastic opportunity to present this very innovative session to you. The University of Pennsylvania is running a 2-week conference, the Global Oral Health and Climate Action Conference, parallel and during the main conference that's happening in Belém, Brazil. And the idea of all these sessions is to generate policy recommendations, some action points that will be collated and then feed back into bigger agendas in WHO and also government agendas. So the material coming out of this session will be very much utilized and taken forward. As COP30 presidency said, we need to go from talking to action and implementation. And this, I understand, is really at the heart of this agenda. So without further ado, I will hand back to Valentina and wish you success for this tremendous session that you put together.
Thank you, Julian. Thank you for this opportunity. And I would like to invite our co-chair, Dr. Elin from Norway, to start this presentation and to introduce our speakers for today.
Thank you so much, Valentina, and hello everyone around the world. Today we come together with a shared commitment to climate resilience prevention, the visionary principle and knowledge of what it takes to ensure holistic health, all in the best interest of both children and the planet. As an advocate for children's rights to quality early childhood education and planetary well-being, I'm honored to serve as the moderator for today's webinar with you world-leading experts on a variety of approaches to our webinar on early childhood education as the first line of NCD and climate resilience prevention. My role as a doctor and professor of early childhood pedagogy and as the director of the Kintnow Research Center for Systemic Research on Education for Diversity and Sustainable Futures in Norway has reinforced my belief that in the critical importance of this topic. And I truly believe that the session today will fuel my energy even more. I will remind us all of the WHO UNICEF Lancet Commission, led by Helen Clark, stated in 2020, a future for the world's children. They write, despite dramatic improvements in survival, nutrition, and education over recent decades, today's children face an uncertain future. Climate change, ecological degradation, migration population, conflict, pervasive inequalities, and predatory commercial practices threaten the health and future of children in every country. And in the faces of this polycrisis, which significantly impacts early development, it is essential to create opportunities for bodily and emotional resilience and for joining forces across disciplines, sectors, and national borders. So I'm genuinely excited about the relevance and urgency of our discussions today and a response to this uncertainty as knowledge workers gathered here, becoming global agents for sustainability by sharing our insights and evidence. Because it is evident, beyond any doubt, that early childhood education is vital, not only for children's development and education, but also for fostering long-term resilience in our societies. So, through this webinar, we aim to raise awareness about the significance of early childhood education and emphasize that children's best interest must matter more in policy making and in everyday practices. The Bangkok Declaration from last year expressed the urgent need to intensify efforts to mitigate the substantial health, social, economic, and environmental impact of oral diseases and health systems and societies. So As a response to these concerns, we will explore recent research, insights, and ideas helpful to enhance, protect, and innovate actions, policy, and the pedagogy within the early years institutions, as well as the ecosystemic levels of society, for the supports of child life and holistic nature of development. This encompasses essential aspects such as early cognitive and social growth, foundational learning, responsive care, responsible innovation, nutrition, health, safety, and protection. And I will also mention play, because we must not forget the meaning and joy of life in all the serious concerns. Through our conversations today, we will uncover how empowering children to care for self-protection, care for others and the planet can lay the groundwork for resilient communities and societies. And we will examine a broad range of conditions fostering international collaboration to tackle the threats and challenges facing future generations. Welcome to you, Alison Baulos, Executive Director, Center for the Economics of Human Development at the University of Chicago, USA. We are so looking forward to listen to your talk about the economic irreversibility of delayed action, why early prevention is not a moral choice, but an economic law. You carry the legacy of the work of Nobel laureate James Heckman. His research on the long-term economics returns of early childhood investment strongly reinforces our argument that prevention and education are inseparable. So the floor is yours.
Thank you so much. Can you hear me and see my slides? Yes, excellent. Okay, excellent. Thank you. I'm so honored to join your virtual stage here with such an inspiring cohort of distinguished individuals, and clear how committed everyone is to the well-being of children. And yes, I'm Alison Baulos, Executive Director of Center for the Economics of Human Development at the University of Chicago, which I co-founded with Nobel Prize-winning economist, Professor James Heckman. I worked with him for about 20 years now, time flies, and we've been studying early childhood interventions and the impact they have. So our research is fortunate to have a global network of partners and collaborators. So today I'm going to highlight for you some of our innovative research from both our group and that of our partners. And this will build on some of what you heard earlier and provide some of the evidence about the impact over the life cycle. So rigorous research has demonstrated that public and private investments in programs that serve children and families have exponential returns on investment. We're not the first to have done this. I think people have been trying to do this for a long time, but of course, science evolves, as the last speaker alluded to, with AI, and we can study the mouth, same thing. We have a lot of new opportunities to understand human development. And we see how those gains both come to individuals as well as the returns to society. So some of you may be familiar with this graph. It's motivated by an array of empirical evidence from studies that we've done and others on human capital programs. So what this graph represents is the return to a unit dollar invested at different ages and the productivity, the efficiency of the return on that dollar invested. So this is not to say that investing early is the only place to that societies and individuals should invest, but really those in adolescence and teenage years and adulthood do matter, but they're more efficient when you're building from a solid base. So the theory of our research on the economics of human development is this technology of skill formation. So our research is unique in that we followed these programs into adulthood and think about how the impacts unfold over the life cycle. And what we see is that these programs are economically efficient and the benefits outweigh the costs in both the short term and the long term. And the effects carry over to siblings, as well as the parents, as well as their own, the children of the children. So in the most simple terms, skills beget skills. That's the concept of dynamic complementarity. That's an economic concept within the technology of skill formation, and promoting early childhood development is the foundation upon which you're building more human and social capital. And it's the first and most important investment of any future investments, especially for children who are at risk for abuse or neglect. And as such, it should be the first priority. Because we do know that there's a lot of evidence on how neglect and abuse really stunt growth. And when this happens early, before children have had a chance to build skills, it really can inhibit human flourishing. And children are not mini adults, rather these are individuals who are still growing. So the challenges and the opportunities put before them in the environments that they're in are really critical. So in public policy and philanthropy, many programs are going to invest in one particular area, thinking of food insecurity, literacy, early learning and childcare, mental health. But early childhood programs are a place where all of these can be unified. Like the last speaker was saying, nurses will come either to the home or to school. So this is a place where it's economically efficient as well as equitable to promote opportunity and to counter the effects of neglect or abuse. So here first, I'll talk about I'll talk about 3 projects today. This one, the first is from Jamaica and our partners at UCL and the University of West Indies. So if you're not familiar with Jamaica Reach Up and Learn, they did a randomized control trial in the 80s and examined this is an intervention that targeted stunted children in Jamaica. It was a home visiting program for these children who were at risk for low physical development. So it was a nutrition study, but what was innovative is that they added an arm that also looked at what they called psychosocial stimulation. And so it's where a home visitor is working with the parents on child development activities and investing. So they went beyond health, went beyond nutrition, and focused on parenting and interactions when the mothers were, or sorry, with the mothers when the children were between 9 and 24 months old. So we joined with this group when they were following the study up at age 23, at age 31. And what we found was that the participants whose parents received that parenting support, again, not just the nutrition, but also thinking about parents, the gains in IQ as well as cognitive flexibility, they were much higher than those that didn't receive that. We also saw effects on reduced depressive symptoms, lower instances of substance abuse, and lower risk taking. So this was just an hour a week. So how can something so moderate be so important? Again, the cognitive, social, and emotional benefits had a positive impact on education and earnings, and these things compound over the life cycle. And that showed through in the evidence. The participants were more likely to attend college and had 43% higher wages than just the control group. So Reach Up and Learn now has been adapted. It's in many countries. And we are working with a partner in China to study. And again, this is a low cost, high impact intervention that's proven to be really adaptable across a host of cultural contexts. And so we hope to keep working with them and collect additional data about the mechanisms, understanding how these really unfold. So to switch gears, there are 2 studies in the US I'll talk about. Absidarian was a full-day center-based childcare program from 6 weeks up until a child was in school, and it provided a language-rich environment with supportive interactions between adults and the children. They also did feature some health. So meals were provided as well as medical checkups. There was a nurse and a doctor who would come in weekly. So the team, when we were looking it up, we did include the health impacts later. And this is one of the areas where there was a significant return on investment due to the impacts on health. And the program more than paid for itself. Again, people think of it as very expensive. This was full day, full year, when a child was 6 weeks up until school entry. But here you're going to see the benefits are not only back to the parent who was working, not just to society by reducing crime or promoting wages, taxes, but also through the quality of life that the individual, that the child, as they were an adult, obtained. And so this was the first study to think about, to look at the long-term impacts on health. And again, the program did pay for itself. And in public policy, it's important to think about where these things fit. And working parents is something that has always been, it seems a new problem, but or a new development, but it has been there for a long time. And so there are additional health outcomes that are seen. And so those health investments, when the child was early, when they were in the program, they didn't specifically work with the parents, but the children received more health inputs. And so we see that there was lower chronic disease, incidence of obesity, prevalence of risk factors for cardiovascular and metabolic diseases, such as stroke and diabetes. And so these comprehensive programs in early childhood not only increase economic productivity, but also decrease the prevalence of chronic disease and healthcare spending in the long term. And then these gains are passed from one generation to the next. So the return on investment is, again, not just the return to the individual, as it's also the family, it's also the society. And not just economically, also in terms of quality of life. So the final study I'm going to preview is called the Peri-Preschool Study, and we've worked with the High Scope Educational Research Foundation and followed these children up until age 50. And many studies of the long-term early childhood programs, most were studied and run by psychologists. So in working in economics, there's a number of ways in which we take a fresh look. And one of them that I've appreciated, Professor Heckman said, what happened in the classroom? So we went back and we found the teachers, we've talked to them many times and gotten their views on how and why this program had such significant effects. And it was really amazing when they think about field trips and children's experience with the world, with the earth, with their community. And they felt this was important, and they kind of mourn what a lot of childcare programs, for many reasons, these children aren't in environments where they receive the same ability to engage. Sorry, one quick moment. So in the Peri, what was unique, again, in Abecedarian, we looked at health specifically, and in Peri, we were able to collect some data about the children of the children. And we saw impacts. So this, again, increases the rate of return to those original dollars invested. We see that when the children that were in the Peri-Preschool became parents, their children had stronger outcomes. They were more likely to be employed, less likely to be suspended from school, be in better health. And why might that be? Well, the children in the Peri-Preschool program were more likely to be to raise their children in stable households. They were partnered and married. Both parents were in the home. They delayed fertility a bit, had children later in life when, their education and employment was more stable. And the children of those Peri participants then spent 3 times the amount of time in a home with 2 parents through to young adulthood. These results were even more significant for the male participants. So male children of male participants spend about 15 times as much time with stably married parents before they turned 18. So here we can think about early childhood investments, again, the children, the families, as well as the economy. And these programs that I have mentioned were all targeted. The dollars spent were because this was for disadvantaged children across a number of risk factors, and they were trying to close gaps. But I think we need to think more broadly about what is child poverty, and it's about the environments they're in. It's not just income. There are wealthy children who also don't receive the same stimulating, nurturing environment that these children were able to receive through these programs. So policymakers hear the evidence that I've presented, and many, how wonderful. They're excited about early childhood. They want to scale up programs. But the science needs to continue. We need to understand how and why these programs operate, and therefore how to scale them. So when we look deeper, we need to look at the workforce, right? This is a care workforce. We are trying to motivate caring of children through teachers and through parents. So in these programs, it's important for me, I want to point out that workforce was intentionally focused on, and the support of them was focused on. The teachers and mentors in all of those 3 programs were hired from the community. They had some shared lived experience with the families that they served. I think they could see themselves in the families or the children. And so in that way, they really were able to act as coaches or guides rather than just a teacher or thought of as a clinician. Also, their wages were in line with the teachers in primary schools. They had, in the case of Perry, they had flexibility, autonomy, and support to do what they felt was best for the children. So we, in our center, wouldn't say that there's just one specific way that needs to be done with fidelity. I think we think of these interactions and human development as a dynamic process, and it can and should adapt and unfold within a community. I'm a social worker by training. So one of the things that's been clear to me working in this space for 2 decades is, again, just how important being strengths-based through all levels of an organization. And I don't think this is really considered enough or studied enough. If we think about, again, just down from the funder and the policy to the organization, to the service provider, to the parent, to the child. So when we think about investing in the child, we also need to think about how everything else plays a role. And to hold parents and children at the center and to empower them and think about who is the best advocate. And so that's where our evidence right now would point to, and Professor Heckman would argue, working with parents, working with families, that's the most economically efficient place to invest rather than just for example, a child care center. I will say through our programs, what's interesting is that parenting does improve, for example, in Abecedarian when the parents weren't themselves targeted, I think because a child in that enriched environment, the interactions with adults, then when they come home, they're eliciting different behaviors from their parents. They have different expectations of investment. So enriched early childhood programs, it can be childcare, can be parental supports, mental health, family leave. All of these things are important. And so with this understanding of the economics of human development, I hope you understand more how programs that aim to improve children's welfare do so through a set of outcomes. So it's not just cognitive skills, socio-emotional skills, or health, but all of these put together build over a life cycle, and they really do translate into dollars and cents for families and for societies. And the delay is costly, and this is imperative. So thank you so much.
Oh, thank you very much, Alison. You really have a strong evidence for a very strong message. So prevention is, you could say, an economic obligation for a national state. Yeah, so invest in early childhood. That was what I read from your evidence. So thank you very much.